So let's go over some of the upper extremity bones, starting with the humerus. This is the anterior side of the humerus. This is the posterior side. So we know the anterior side is going to have this bump right here, which is our lesser tubercle. So that's going to help orient us. The head of the humerus is always on the medial side. So opposite the head on the lateral side is going to be the greater tubercle. Lesser tubercle is anterior. In between the two tubercles is the intertubercular sulcus, in between the two tubercles. You could also call this the bicipital groove because the long head of the biceps tendon passes through this groove on its way to the scapula. Right here on this lateral side is the deltoid tuberosity, the attachment point for the deltoid muscle. If we stay on this lateral side, we have the lateral epicondyle, and then we have the capitulum is on the lateral side. So I think of El Capitan, lateral capitulum. Right here is the trochlea, which kind of resembles a pulley system. And then this would be our medial epicondyle. This corn-shaped fossa is going to be the coronoid fossa. And then, so we're able to label everything on the anterior portion except for one, which is this one. This is the olecranon fossa. So let's do the ulna next. You can know that this is the ulna because we have this U shape right here. If I flip it over this way, that's the U shape for ulna. This portion would be the olecranon. So we're talking about the elbow right here. So the olecranon or the olecranon process. This would be the trochlear notch, which fits around the trochlea to make the elbow joint. This right here is the coronoid process, which sits in the coronoid fossa when the elbow is in flexion. Right here is the radial notch, where the radius contacts the ulna. And then this down here would be our styloid process. Think of a stylus that you would write on a tablet with. For the radius, I'll flip it over here. This is the head of the radius. This is the radial tuberosity. On this side, we have the styloid process. And then right here would be our ulnar notch, where the ulna contacts the radius. Next is going to be our hand. So very similar to what we talked about with the foot, except this time we have carpal bones, which make up your wrist. We have metacarpals, and then we have the phalanges all up here. So this would be digit 1, 2, 3, 4, and 5, so we number accordingly. So this would be metacarpal 1, 2, 3, 4, 5, proximal phalanx 1, proximal phalanx 2, 3, 4, 5, middle phalanx 2, 3, 4, 5. The thumb does not have a middle phalanx. And then distal phalanx 1, 2, 3, 4, 5. So if I wanted to name one individually, we could say metacarpal 5, proximal phalanx 4, middle phalanx 3, distal phalanx 2, and we could just say proximal phalanx 1.